Today for Mary, we're going to do a fractional laser treatment. So the fractional laser is a laser that we use classically for treating sun damage. And the signs of sun damage that Mary has got is some uneven pigmentation, there's some fine lines, there are some open pores, and there's also a couple of little acne scars around here. So these are all the classic things that fractional laser is really effective at treating. The way that fractional laser works, it is what we call an ablative laser, which means that it is removing some of the top layers of the skin, which causes a healing response, and in turn, that when the skin heals, it heals in a more healthy condition, the way that it perhaps would have been a few years ago, or if we hadn't had accumulated as much sun damage. Sorry, that sounds really awful, doesn't it? So the treatment, there's a couple of ways that you can do fractional treatments. We can either do the one big treatment where your face is really, really badly burnt for about a week to 10 days afterwards. Or we can do a course of treatments, which is what we're going to do for Mary, where we're using a slightly more gentle setting, but repeating the treatment once a month for maybe 4 months or so. So for the first session today, we're going to go really nice and gentle and see how Mary's skin reacts to it, see how she copes with it, see what it's like when she goes back to work on Monday. This is Saturday. So we're going to take it nice and gentle with the first one, and then we will see, and then from the second session onwards, we'll think about upping the settings, going a little bit deeper, but the deeper we burn, the more redness and swelling we're going to get, but also the better the result. So it's getting that nice balance between doing enough that gets us a good result, but also trying to make it manageable so that it can fit in with your lifestyle. So Deborah is our laser therapist who carries out all of the treatments in the clinic. So Deborah I'm going to hand over to Deborah. So Mary, if you have a wee lie back, I'll just explain what some of these contraptions are. As we're carrying out the treatment, there is a little bit of plume that's generated. So this machine here evacuates that. We've also got the cooling machine, so Mary is going to hold that in her hand. And as she starts to feel the temperature of the skin rising, she can direct that to whatever feels warm for her comfort. She's going to wear some blackout glasses so she can't see anything, and then Deborah's going to get the settings up on the laser and she will get underway. Okay.
So what you're going to do is just some cold air coming into this wee tube. It's literally just going to keep your face all cool, okay, for me, Mary. And anytime you want to move it, just move it around. You'll find it's really nice. It's just quite kind of soothing. So I'm going to turn it up a wee bit, and then just take a few seconds to come on, okay? And what I'm going to do, before I do anything, I will always tell you, alright? Seconds. You'll hear that, okay? And you'll feel the nice cold air, alright? If you'd like that a bit, just let me know. I always start at the top of your forehead. You don't think I'm going to just actually pop it down slightly. Are you feeling okay?
So when our therapists begin doing the treatment, we usually start at the top of the face and work our way around. When we start firing the laser, you expect it to be quite warm immediately. Actually, it takes a little bit of time for the heat to build up within the tissues and for you to start to appreciate any discomfort. And that's why we give the cold air to the patient to hold, so that you can be in direct control of whichever bit is starting to heat up. You can fire the cold air directly at it for your comfort. In this situation, because the patient was going to work 2 days later, we were being really gentle with the setting. The laser can be used at different penetrations depending on what we're trying to achieve. So for example, if we're just trying to achieve some really superficial pigmentation changes or roughened skin texture, then it can be okay to be really superficial. But if we're trying to target deeper things such as acne scarring or more sort of deeper fine lines and wrinkles, then we will definitely want to be going deeper with the laser so that we're getting deeper down into the skin and we're going to achieve more collagen remodeling. But that does have the knock-on effect of making the redness and swelling worse after the treatment. So quite often we sort of start a course of treatment on a sort of more medium level setting, and see how you tolerate the first treatment session. And assuming that everything goes okay with that and you feel quite comfortable with that, then when we move on to the next session, we can start increasing the depth of penetration that we're going to, and really just titrate the treatment to work with the patient's lifestyle. Typically, patients will usually have a course of maybe 4 of these treatments, 1 a month for 4 months, and then often patients come back just for a single session, maybe every year or so, just to give their skin a refresh. No question there is some downtime with this treatment, but for the right indication and for the right skin type, it does have a really nice impact on the overall quality of the skin. A lot of people focus very much on the deeper lines and wrinkles and volume loss, and focus a lot on, for example, lifting or volumizing, but improving the actual quality of the skin itself can be equally as important in restoring the face. And usually the patients who achieve the best overall outcome from treatment are the patients who combine multiple modalities of different treatments. So for example, having injectables, but also having some laser treatment and some IPL treatments to look at the quality of the skin as well as the deeper structures.